Hello everyone, my name is Shamdale Blanco, a student nurse from BSN 111D, and today I am going to do an eye assessment. Eye are the organs of the visual system, detect light and convert it into electrochemical impulses in neurons. So first, we need to review the client's previous medical records if available, and also we need to determine the scope of the assessment needed and prepare the necessary equipment such as a pen light, an opaque card, the Snellen chart, ball pen, and the worksheet, and also the alcohol for hand hygiene. So this is to ensure organization and increase efficiency in performing the assessment. Also, we need to perform hand hygiene prior to the assessment to deter the spread of microorganisms. So first, we need to greet the client politely, introduce ourselves, and verify our client's identity. And ask the client on how he would like to be called during the assessment and establish rapport. So we also need to explain the procedure to the client and how she can participate during the assessment and provide the client the opportunity to clarify or ask any concerns. So introducing the self to the client enhances rapport, and verifying the client's identity ensures that care is being rendered to the correct client. And also explaining the procedure to the client can reduce the client's anxiety and enhance cooperation. So good morning, ma'am. I am Charmdale Blanco. So I am going to be your student nurse for today. So may I verify if you are Betty May Cordevilla?
Yes,
Okay. So how would you like me to call you, ma'am?
just Betty.
Okay, Betty. So are you okay right now?
Yes.
Okay. So Betty, today we are going to do an eye assessment on you. So there are various eye tests that we need to conduct. So I just need you to follow my instructions. Is that okay?
Okay.
Okay. So after that, we need to ensure the client's comfort, privacy, and confidentiality. So it would be sure that the assessment place is safe and secure and free from distraction. So we also need to position the client to be seated comfortably. This is providing for the client's privacy, protects the client's integrity, and enhances comfort. So and proper positioning facilitates client's comfort and efficiency in performing the assessment. So, ma'am, I have already locked the doors, and rest assured that the data gathered today will be strictly confidential between me and your attending physician. So, ma'am, do you have any other question before we start?
None.
Okay, thank you. So, now for the assessing the visual acuity. So, first, we need to assess the distant visual acuity. So this is to check how well a person can see the details of a letter or symbol from a specific distance. So also we need to check for use of any visual aids prior to starting the test. This is to ensure that there is no hindrance in the patient's visual capacity. So ma'am, do you have any visual aids that you use?
No.
Okay. For now, so we have here the Snellen chart. So we have to get the client stand or just being seated 20 feet apart from the Snellen chart with the cover the eye being tested, and ask her to read each line until she cannot decipher the letters. Also, we need to take 3 readings, the right eye, left, and both eyes. And also, we need to record the readings of each eyes and both eyes. So, okay. So, ma'am, can you read for me in your both eyes?
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P.
Okay. So we have here the opaque card. So please cover your left eye. So please read it.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P.
So your your right eyes, ma'am.
E F P T O Z L P E D P E C F D E D F C Z P.
Okay, thank you. So after that, so it is your eyesight is very good. So after that, we need to perform the selective vision test, such as light perception, hand movement, then counting fingers, if the client is unable to see even the top line of the Snellen chart. So we need to assume that my client is unable to see the top line of the Snellen chart. So first, we need to do the light perception. So, mom, I'm going to light this pen light. So, tell me if you can see the light, okay?
Yes.
Okay.
Yes.
Okay. So, next, if the client is unable to perceive light, we need to do the hand movement test. So, Betty, so tell me if where did my hand gesture points at, okay?
Up, left, down, right.
Okay, thank you. So now the last is the counting fingers if the client is unable to identify the hand movement again. So tell me how many, okay?
3, 3, 2, 5, 1.
Okay, so that's it. So next is for testing the visual fields. Now we have the patient face. We need to face the patient rather directly at a distance of 60 to 90 centimeter and instruct the client to look directly into the examiner's eyes with both eyes and place hands about 2 feet apart and lateral to the patient's ear and slowly move the wiggling fingers of both hands along the imaginary bowl until the patient identifies them. Okay. So, ma'am, I am going to widen my hands lateral to your ear. So, so tell me if you can spot my wiggling fingers. Okay.
Yes. Yes.
So we need to repeat the action in the upper also and lower temporal quadrants.
Yes. Yes. Yes.
Okay, so now if a defect is detected, we need to slowly move the wiggling fingers from the defective area of the field toward a better vision. So we need to repeat this at several levels until the border of the defects has been undefined and test other eye for an accompanying defect. So so we need to assume that there is a defect. Okay. So ma'am, can you tell me if you have seen? Okay.
Yes. Yes. Yes.
Okay. Now next is the visual inspection of the eye. So we need to visually inspect the eyes for alignment and symmetry, and also inspect the eyebrows for the hair distribution and alignment and skin quality and movement. So please move your eyebrows up and down. Okay. Now we need to inspect the eyelashes for evenness of distribution and direction of curls. Also, we need to inspect the eyelids for surface characteristics, position in relation to the cornea, ability to blink, and frequency of blinking. So we need also to inspect the lower eyelids while the client's eyes are closed. And also, addition to that, we need to inspect the area over the lacrimal and lacrimal gland and lacrimal sac for swelling. Please close your eyes. Okay. Now we need to ask the patient to look up, and we need to depress the lower lid of the patient with one thumb afterwards to assess the sclera and bulbar conjunctiva. So, look up, ma'am. Look up. Okay. And after that, we need to invert the eyelid to assess the palpebral conjunctiva. So, excuse me. Now, we need to inspect carefully each iris and pupil. Also, inspect each cornea and lens for opacities, clarity, and texture. So, we need to shine a pen light from the side toward the eye, or shine a pen light at an oblique angle to the eye, and move the light slowly across the corneal surface. And so, ma'am, please look straight to me. Look straight at me, ma'am. So next, we need to now to assess the direct and consensual pupillary reaction to light. So we need to assess that each pupil's direct and consensual reaction to light. So this is to determine the function of the third cranial nerve. So we need to darken the room partially. Okay, so we need to and ask the client to look into the distance, and we need to shine a light obliquely into each pupil in turn. So, okay. Okay, we can now turn the light on. So look for in doing that, we are looking for the direct and the consensual reaction. So the direct response is the change in the pupil size in the eye to which the light is directed, while the consensual reaction is the constriction of both pupils when light is directed at one pupil. Okay. So next is the assessing the accommodation. So assess each pupil's reaction to accommodation. Also, this is to determine the function of the third cranial nerve. So we need to hold an object or a pen light about 10 cm from the bridge of the nose of the client, and ask the client to look first at the top of the object and then at the distant object. So we need to instruct the patient to alternate the gaze from the near to the far object. And we also observe the pupil response. So, ma'am, please look at the pen light and the back of the pen light. So, alternate your gaze, ma'am. Okay, thank you. And now, we need to ask the client to look at the near object and then move the pen light or pencil towards the client's nose. So, look only at the pen light, okay? Okay, thank you. And so now we need to perform the Hirschberg test. So this is to assess the ocular alignment arising from the extraocular muscles. So first, we need from about 2 feet directly in front of the patient, we need to shine a light into the patient's eyes and ask the patient to look at it. We need also in this we inspect the reflections in the cornea and look for the direct and consensual reaction. So ma'am, please look only at the pen light, okay? The light. Okay. Now wait. So next is performing the cardinal fields of gaze test or the extraocular muscle test. So we need here we need to assess the extraocular movements, looking for normal conjugate movement of the eyes in each direction or any deviation from normal nystagmus, lid lag, and convergence. So this is to determine the eye alignment and coordination. So we need to stood 2 to 3 feet in front of the patient and ask the patient to follow the examiner's fingers or pencil while making a wide H in the air. So also we need to look for the jerky movements of the nystagmus or on the lateral gaze and on upward gaze. And also we need to watch the rim of sclera between the upper lid and iris as the eyes move up and down. Okay, ma'am, please follow where I'm going to have this pen light, okay? Okay, thank you. Okay, so after that, for the last test, we need to test for convergence. So we need to ask the patient to look at the examiner's fingers as the examiner moves it toward the bridge of the nose, and we need to check for convergence. So, ma'am, again, please look only at the pen light, okay? Okay, thank you. So now that is the assessment. So that is the end of the assessment. So now I am going to summarize all the gathered data that in throughout the assessment. Okay. So if you have any question, please raise it. Okay. So for the assessment of the visual acuity, your right, left, and both eyes has 20/20 sight. Your visual fields, you can able to sight 50-degree upper, 70-degree lower, and 62-degree side-to-side visual fields. So for the visual inspection of the eyes, the eye alignment and symmetry are all good. Your eyebrows, hair is evenly distributed, the skin is intact, it is symmetrically aligned, equal in movement. And for the eyelashes, it is equally distributed, curled slightly outward, and also the eyelids, in the eyelids surface, the skin is intact, no discharge, no discoloration. Lids are closed symmetrically, so it has 15 to 20 involuntary blinks per minute and bilateral blinking. So no swelling over the lacrimal gland and lacrimal sac. And your bulbar conjunctiva is transparent and your sclera appears in white. Also, the palpebral conjunctiva is pinkish. The iris and pupil are all normal. No opacities noticed on the cornea and lenses. So, in assessing the papillary reaction, illuminated pupil constricts for the direct response. Non-illuminated pupil constricts for the consensual response, and the response is brisk. And while in the assessing the accommodation, so the pupils constricts when looking at near object, and the pupil dilate when looking at far object. And for the extraocular muscle test, both eyes are coordinated with parallel alignment, and lastly, in the assessment of the convergence, pupil converge normally. So, do you have any question?
None.
Okay, so ma'am, this I have here a plan for you, or like advice in order to have your eyes healthy. Okay, so ma'am, to avoid future eye problems, you need to keep your eye always healthy and avoid keeping your eye too much exposed to sun, to such light rays, or even on gadget that we usually use most of the time. And also have your eyes rest once in a while. Okay, so do you have any question?
None.
Okay, so After that, we need to thank the client and ended the interview politely, and do not forget to perform hand washing. So thank you for your time, ma'am. So thank you for your coordination throughout the assessment, and I wish you the best. So you just need to keep your eye healthy. And thank you very much. So after that, as I've said, do not forget to do hand washing or do hand hygiene, and also document the findings in the client's record.